Outcome 3 is about fees, and it's looking for patients to have an understanding of the charges that are associated with treatment and the payment policies and what's expected of them when it comes to payments. A patient would experience a well-documented treatment plan which includes all the charges associated with treatment that they're going to have, and a clear understanding of which aspects might be being provided on the NHS and which aspects of care are being provided privately. Practices could prepare for this by referring to the NHS Choices website and also by downloading the NHS Charges poster and displaying it. That's available on the Department of Health website. When it comes to charges outside of the NHS, practices should have some sort of a fee guide, a printed outline of their charges or a range of charges, and ensure that the exact costs of treatment are documented on treatment plans. First of all, a practice manager should make sure that the NHS Charges poster is displayed, because that's a requirement. The manager should also ensure that there are private price lists available for any treatment provided outside of the NHS. If the practice provides any sort of payment plans or payment schemes, they should be well documented and outlined in a format that they can present to the patient. And overall, the manager should make sure that the practice has systems in place for the patients to know whether the fees relate to treatment being provided in the practice, on the NHS, outside the NHS, or on referral. Our practice management manual for CQC will help you reorganise your existing quality assurance practice systems in 3 steps. First of all, use the A3 checklist for this outcome from the back of the manual to audit your compliance. This gap analysis helps you to identify actions that will improve outcomes for people who use your services, in other words, your patients. Then use the agenda from the front half of this manual to conduct a training session for your team. It includes an attendance record, and a training pack is available from our website. Finally, show your team the results of your gap analysis for this outcome and discuss who will work on items marked amber, which you've identified that you have but may need updating, and who will action items that are marked red, which you have identified are outstanding pieces of work. Examples might include a business continuity plan. Once you've decided which audits are required to measure, monitor and modify your systems, you're ready to record your agreed action plan at the bottom of the agenda and to set a time frame for completion. For efficiency, I'd suggest you give each team member a manual so that they have a personalised individual training record and an action plan to work from. This way they can concentrate on recording and completing the tasks delegated to them and demonstrate their involvement to a CQC assessor. As a practice manager, your copy will be the master audit plan for the whole practice, as well as your master training record, helping you to ensure the practice meets the outcomes in section 4 of the CQC guidance, which is suitability of staffing.